The federal government now says states should open up the COVID-19 vaccine to all people aged 65 or older and adults that are considered high risk.
The change was first announced yesterday, and it would make more than 2 million more Minnesotans eligible to get a vaccine than originally planned. But as WCCO's Caroline Cummings explains, state health officials say they don't yet know if vaccine supply will meet demand.
We're both having issues understanding why the Minnesota Department of Health is failing us so dramatically.
Some of Minnesota's seniors and their caregivers say they're frustrated they aren't getting more information about when they can get vaccinated and how to go about doing that. 73-year-old Stillwater resident Joyce Lindgren told a Minnesota Senate committee Wednesday that she even turned to her health care provider for answers, but they didn't have any more information to share.
And I cannot believe that the state and one of the largest medical facilities in the state has not been planning for vaccinating the next groups.
Today, more than 155,000 Minnesotans who fall under the first tier of Phase 1 have had at least one dose of vaccine. That's about 3% of the total population. The rollout has been slower than anticipated, and now the federal government recommends states open up vaccine to more people to speed up the process and ensure no doses languish unused. Under the new guidance, people over 65 and adults with underlying health conditions would be eligible. That would be 2 million more Minnesotans and 4 times more than the 500,000 people in Phase 1A.
We're not going to be even through 1A before the expansion is expected to happen.
Minnesota Department of Health Commissioner Jan Malcolm says there's still a lot of unknowns. Officials say this new guidance came without warning, and there still is nothing in writing, so they're trying to manage expectations.
One of the advantages of opening up to broader groups of people is it's simpler to understand, and there's less question about who falls in what group if it's age-based and health condition-based. The problem is just the population has expanded hugely and the vaccine supply has not, at least not yet.
At the Capitol, Caroline Cummings, WCCO 4 News.
Right now, 60,000 doses are shipped to Minnesota each week, which means a supply and demand mismatch. This week, the federal government said it will change its allocation based on pace of administration and size of the state's population of people 65 and over.